In 2024, the word monkeypox has once again triggered alarm bells across the globe, particularly in the United States. The resurgence of this viral disease has stirred memories of the COVID-19 pandemic, leading to a new wave of anxiety and uncertainty. News outlets are inundated with updates, social media is rife with misinformation, and public health officials are urging caution. The images of pustular rashes, coupled with reports of increasing cases, have left many wondering if we're facing the next major health crisis. But is the fear justified? Or is this another instance of a rare disease being blown out of proportion? With the world still reeling from the impacts of COVID-19, it's understandable that any emerging infectious disease would provoke concern. However, to fully grasp the situation, we need to delve into what monkeypox is, where it came from, how it affects the body, and what the latest developments tell us about the potential risks. The story of monkeypox begins in the late 1950s. In 1958, scientists identified a pox-like disease in monkeys being used for research, which led to the naming of the virus. However, it's important to note that despite its name, monkeypox is more commonly found in rodents than in monkeys. The first recorded human case didn't occur until over a decade later, in 1970, in the Democratic Republic of the Congo. At the time, the world was still under the shadow of smallpox, a far more deadly and widespread virus. As smallpox vaccination efforts intensified, cases of monkeypox remained relatively isolated, mainly in remote African villages. For decades, it was considered a rare zoonotic disease, one that primarily spread from animals to humans, with limited human-to-human transmission. However, as time passed and smallpox was eradicated in 1980, routine vaccinations ceased. This cessation inadvertently left the door open for monkeypox, as the smallpox vaccine had provided cross-protection against it. In the years that followed, outbreaks of monkeypox continued to occur sporadically in Central and West Africa. These outbreaks were usually linked to contact with infected animals, such as rodents or non-human primates. Unlike smallpox, monkeypox didn't spread easily between people, which kept the outbreaks relatively contained. However, the situation began to change as global travel and trade increased, making it easier for the virus to move across borders. The first major international outbreak occurred in 2003 in the United States, when a shipment of African rodents brought the virus to North America. This outbreak resulted in over 70 confirmed cases, mostly linked to contact with pet prairie dogs that had been infected by the imported rodents. While the outbreak was quickly contained, it served as a wake-up call that monkeypox was not just an African problem, but a potential global threat. Now, let's break down what happens when someone contracts monkeypox. The monkeypox virus is an orthopox virus, which means it's related to the viruses that cause smallpox and cowpox. Once the virus enters the body, usually through broken skin, respiratory tract, or mucous membranes, it begins to incubate, a period that typically lasts from 5 to 21 days. During this time, the infected person may not show any symptoms, but the virus is multiplying and spreading throughout the body. The illness often begins with non-specific symptoms, such as fever, chills, headache, muscle aches, and back pain. Symptoms that can easily be mistaken for the flu or another viral infection. This is followed by lymphadenopathy, or swollen lymph nodes, which is a distinguishing feature of monkeypox compared to smallpox. Swollen lymph nodes can occur in the neck, armpits, or groin, and can be quite painful. Within a few days of the onset of fever, a rash develops. This rash typically starts on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. The rash undergoes several stages. It begins as macules, flat lesions, then progresses to papules, raised lesions, vesicles, fluid-filled lesions, pustules, pus-filled lesions, and finally crusts over and scabs. The lesions are often deep-seated, firm, and can leave permanent scars once healed. For most individuals, monkeypox is a self-limiting disease, meaning it resolves on its own without the need for specific treatment. The illness usually lasts for 2 to 4 weeks. However, in some cases, especially in people with weakened immune systems, complications can arise. These complications may include secondary bacterial infections, respiratory distress, sepsis, and in severe cases, encephalitis, inflammation of the brain. The case fatality rate varies depending on the strain of the virus. The West African strain has a lower fatality rate, about 1%, while the Central African strain can be much higher, up to 10%. As we move into 2024, the global landscape for monkeypox has shifted significantly. The recent surge in cases has raised alarm, particularly in non-endemic countries like the United States, where the virus is not typically found. This increase in cases can be attributed to a combination of factors, including increased international travel, changes in human-animal interactions, and possibly the virus's evolution. In the United States alone, the CDC has reported over 1,000 confirmed cases in 2024, a significant rise from previous years. These cases have been primarily concentrated in urban areas, with some states reporting clusters that have sparked concerns of localized outbreaks. The virus has been spreading primarily through close contact, including skin-to-skin contact, respiratory droplets, and even sexual contact, particularly in settings with high-risk populations. Health officials have responded by ramping up vaccination campaigns, particularly targeting those at higher risk, such as healthcare workers, people with compromised immune systems, and individuals in close contact with infected persons. The Jynneos vaccine, originally developed to prevent smallpox, has been shown to provide effective protection against monkeypox and is being distributed in areas with active outbreaks. Despite these efforts, the rising numbers have led to renewed debates about the adequacy of public health infrastructure, the availability of vaccines, and the preparedness of healthcare systems to handle another potential health crisis. Public messaging has focused on education and prevention, with an emphasis on avoiding panic while encouraging vigilance. With all this information in mind, it's natural to ask, should you be afraid of monkeypox, especially if you're living in the United States in 2024? The answer, as with many public health concerns, is that it depends on your individual risk factors and where you live. For the general population, the risk of contracting monkeypox remains relatively low. The virus does not spread as easily as airborne pathogens like the coronavirus. It requires prolonged close contact with an infected person or animal. This means that unless you are in close contact with someone who has monkeypox or are handling infected animals, your chances of catching the virus are minimal. However, that doesn't mean you should ignore the situation. If you're in a community experiencing an outbreak, it's wise to take precautions, such as avoiding close contact with individuals who have symptoms, practicing good hygiene, and staying informed about the latest public health recommendations. If you're in a high-risk group, such as those with weakened immune systems or healthcare workers, getting vaccinated is a proactive step to protect yourself. It's also important to stay calm and avoid falling into the trap of misinformation. The rise in cases is concerning, but it's being met with a strong public health response. Vaccines are being distributed, and efforts are underway to contain the outbreaks. Unlike the early days of COVID-19, we have more tools at our disposal to combat monkeypox, including effective vaccines and a better understanding of the virus itself. In conclusion, while monkeypox is certainly a disease to be aware of, it's not a reason for widespread panic. The key is to stay informed, follow public health guidelines, and take appropriate precautions if you're in an area with active cases. By doing so, you can protect yourself and those around you without succumbing to fear.